ماذا لو أن الكفاءات الجزائرية من كافة أنحاء العالم تجتمع معا؟ ماذا لو أن هذه الأدمغة بمختلف تخصصاتها تتكاثف لتطوير التعليم والبحث العلمي للنهوض بالجزائر في مختلف المجالات؟ هل تعتقد أن هذا مستحيل؟ أبداً، فالحلم يتحول إلى حقيقة من خلال الشبكة العالمية للعلماء الجزائريين إيناس. رغم أن إيناس هي مؤسسة غير ربحية وتعتمد فقط على تبرعات الأفراد، إلا أنها استطاعت أن تبني جسوراً من التعاون وتبادل الخبرات بين أبناء وطننا الحبيب من الداخل ومن مختلف بلدان العالم، ساعية لصقل المهارات واحتواء المواهب وتبادل الخبرات وإيصال التجارب النافعة لخدمة الوطن.
بسم الله الرحمن الرحيم. السلام عليكم، مرحبا بكم معنا in a new webinar, monthly webinar في project Earthquake Hazard Mitigation. معكم محمد عمروش. I am the project leader. In this initiative, we try to invite each month one specialist in the thematic of earthquake hazard mitigation. And this month, we are very pleased and honored to have Dr. Nebil Achour. السلام عليكم دكتور.
وعليكم السلام، أهلا وسهلا بكم.
مرحبا بك معنا، شكرا لتلبية الدعوة تاعنا إن شاء الله. Donc I will briefly introduce our keynote speaker today. Dr. Nebil have over 20 years experience in disaster mitigation with particular focus on healthcare. His background is engineering. After he received his first degree from the Tunis Advanced School of Science and Technology in Tunisia, Dr. Achour worked in private engineering and design firms, design structure and training engineer in several countries. He was granted the Japanese government scholarship to further his education, where he gained his master with the focus on response of hospital lifeline system following seismic activity, and his PhD on hospitals fragility assessment. In 2014 and 2007, in 2004 and 2007, respectively, from Kanazawa University. Following his graduation, he was employed as a postdoctoral researcher. In his graduate university, he joined Loughborough University in September 2007 as a research associate. Dr. Nebil has expertise in resilience of healthcare to major hazards, about which he published over 50 scientific articles and reports. And he is also a member of the global WHO Hospital Safety Index revision panel. And today we are very honored to have him in this special lecture titled Healthcare System Resilience Under Major Niger Earthquake. تفضل Doctor, the floor is yours.
First of all, thank you so much, Dr. Amrouche. It's really it's been a great pleasure to receive your invitation, and it's a great pleasure to share with you all and the audience some of my experiences, some of the lessons I learned over the years. It's a lot of research, obviously, but at the same time, it's a lot of reflection as well. And specifically the journey that I took, where you start as a normal engineer and end up with a multidisciplinary engineer or manager, or I don't know exactly what to describe myself at this stage. But it's a great pleasure to share with you all, and this particular this particular session. Am I okay to keep going?
Yes, please go ahead. We can see the slides.
Shukran. Okay, so inshallah, so today we'll be talking about hospitals or healthcare in general, but hospitals specifically. But then hospitals, they tend to be very, very simple, or they look like they are pretty simple. But actually we will discover that they are not. So as you can see in the overview, I literally got just one thing there. It's called hospital systems, and that's all, with a small introduction, obviously. But hopefully we will see that it's not really as simple as we might think. So before we start, I tend to do this a lot. It's great to understand that I cannot perhaps communicate with you directly, or at least I can't hear you, can't get your voice. But I was thinking actually it would be great to listen from me to you. Sorry, apologies, there are some issues here. Right, okay, so I think I've got some issues, so apologies. There we go. This should be the slide. So I want to hear from you. Which country, did you join us from today? And the best way to answer that is at that particular website there on top. It's polev.com/NA32. We'll give you just a few seconds, shall we say. maybe 10, 30 seconds to allow you to go to your browser and type polev.com/NA32 just to hear and to understand where you joined us from today.
Thank you very much. So I remind our audience that we put the link that Dr. Nebil just shared in the screen. So please go to this poll and write your country. I think we have few people online here. Just to have a better interaction, I invite you to go to this link and register the details of information so that we can have a more interactive webinar, inshallah.
That's the expectation to find from Algeria.
So yeah, we remind you that you can Portugal. Wow. So
yes,
you can use rather a smartphone or a web page for that.
Yes, yeah. Just type it in your browser and you should find this slide. Yes. Okay. I don't know exactly what that is. That's fine. I would say it's Algeria. That's what you're referring to, or maybe Portugal.
Algeria again, yeah.
Yes.
We're expecting many audience from North Africa. So for people who just joined us, we remind you we are running a live poll now, a questionnaire, where you just need to enter the address here, polev.com/NA32, and then you can write the country you are watching us live, so that we can have a better interaction and a better discussion with Dr. Nebil. So this is the first time we do this in our INAS web series. It allows to have a better interaction with participants.
Okay, I think we might go to the next slide because Algeria obviously got very big. That means that most of the people perhaps are coming from Algeria today, which is great anyway.
Sorry, just one comment, Doctor. We have some comments. People from LinkedIn are writing it from Béjaïa, from Algiers, from France. So let me just show that some participants from Algeria, from France, Algiers. So yeah, you can also write down your comments, the region you are watching us live. So maybe some people cannot access the questionnaire, but we get a lot of answers in the comment section. Okay, we have also people from Essex, UK. Hello and good time to all. So yes, thank you very much. Yes, I think we can go ahead.
Excellent. Thank you all. The next question is in one word. Okay, how would you describe disasters? Just in one word. So I don't want to put words in your mouth, obviously, but it's good to hear it from you. What you think of disasters?
Yeah. So this is we use the same link for the poll, right?
Yes.
Okay. Let me just show it again on the screen.
As I change the slides, as they will appear to the audience, basically, if you are on the right page.
So you can also, for our audience, you can probably write on the comments for you in one word, for participant in LinkedIn or YouTube. So you can, in one word, how do you describe disaster? We have resiliency, we have danger. Just write down the words that comes into your mind when you hear about these disasters in general, not only earthquakes, but
yes,
any disaster.
Damage, yes.
So we remind our audience that we are running a live poll now. You can write in one word, how do you describe disaster? You can use the poll you can see on the screen, or you can comment down on the platform. Damage, we have damage, yes. Damage, resiliency, danger. Oh, yeah. Okay, we have even some more details response. It's a Greek word which means disaster, literally means chaos. So yes, it is not a pleasant word for sure.
Yeah. Okay, so if I just basically kind of give a small comment based on these two, that just on these three terms, you've got damage and danger, and both of them are negative. But then there is resiliency or resilience.
Yeah, we have another word, in expected accident. Probably it can help in the discussion. Yeah.
Absolutely, yes, yes.
Yeah.
So here, as you can see, so there are basically some negative, but also there are some positive sides to disasters. And we will talk through them in the next few minutes, or in the next minutes, hopefully. Talk about those opportunities basically that are brought to us through that pain, through the disasters, through that negativity, basically. My last question, and promise after that I will stop, and then we'll go to start the presentation properly, which is about your background. I hope that you don't have the same as I have. So many different backgrounds, which you end up like you don't really understand your own identity. So what is your professional background? Are you a civil engineer? Are you an architect? Are you a doctor? Are you a nurse? So whatever it is, how you describe yourself.
Yeah, thank you very much. So we remind our audience that we are running a live poll. We are asking our audience attending live, to write the background, your professional background. What's your job? What's your professional job? You can use the poll. You can use the link that I shared here on the screen, or you can just write down in the comment sections, and then we will display them to Dr. Nebil. So we have architect, PhD students in architecture.
All right.
Architecture. We have a geologist.
Okay.
We have, I can see engineering, civil engineering, industrial engineering.
Yep.
And we have petroleum engineering. So various of backgrounds sharing our platform today.
Excellent, excellent. Okay, so we've got some good engineering backgrounds here. I hope that we will have some other backgrounds as well joining us. But trust me, for the engineering colleagues, it's not going to be as easy as it might sound. Because that's exactly where I were, about 20 years ago, when I thought that, engineering is everything and that's it. No, there are so many other issues that at the very, very end, as a human being, we've got to find solutions for them. And specifically, if you work in disaster mitigation, where things actually will really interact and will affect, the way how you look at things in general. Right. Okay. So we'll stop the poll now, and then we go to start talking about, the introduction. Let's just start with a small introduction. I believe that many of you perhaps have already heard of the Sustainable Development Goals, or sometimes in Arabic we refer to them as التنمية المستدامة. So what are these Sustainable Development Goals? So these are basically 17 goals that have been developed by the United Nations. And when we say developed by the United Nations, so it means that basically there are so many scholars, so many people were involved in their development, and they came up with these goals. So when you look at these, you actually find that they are very, very comprehensive, and they look at a variety of things far beyond just kind of the engineering discipline or anything. They, as you can see, so we're talking about the social aspects. So there is the poverty element there, for example. There is the hunger. So we're talking about really kind of social aspects there. But then we go, for example, SDG 9, that's when we start talking about the industry, the innovation, the infrastructure, all those things. And we keep going to the political aspects, like for example, number 16, where we talk about justice, talk about peace, talk about all those aspects. Disasters, where they fall, is quite an interesting question. They are in every single one of them. It is as simple as that. That's where disasters are. Disasters because they can be anything, absolutely anything. They can be related to infrastructure, but they can be related to to human. They can be related to many other things. So they are ready there. So these Sustainable Development Goals, basically what is believed that these are the ones that will actually, if we target them, we should have always kind of a sustainable development, of the country or of the organization in general. And that's basically, so when we consider them and we work on them, we should be at really stronger position once, not when we finish, because it's almost impossible to finish. But let's say after you work, for example, 2 or 3 years, you will see where you started and where you ended, and see there's a big difference there, and that there's so much development has happened there. So what are disasters? Okay, and why are we considering disasters? We are considering disasters for a number of reasons, which I will mention in the next few minutes. But prior to that, these are just some figures to show us how natural disasters have been increasing, or they have been performing, or what they have caused us. So as we can see in these small diagrams, which they are pretty old, I have to say. So we can see, for example, on the left one here, is that we've got here, kind of they are really increasing, and specifically since the 40s. Now, there are 2 different theories for this one. The first theory is that the data itself that was collected by the EM data, which is in Europe, it's a really well-known database, EM data. So some people would criticize that as basically we don't have enough data, okay, and that's why the numbers are not really that large, prior to the 1940s. But others will say, even with that, we know that there is, changing in climate. We noticed in the last 20 and 30 years, massive increase of earthquakes, and massive increase of floods, and massive increase of disasters in general, or hazards. Okay, and we understand also, and here I'm talking about this particular figure here at the bottom, that we know that the death numbers have decreased, but despite that increase of disasters, actually the death number have decreased. Why is that? That is simply because of the regulations, because of the preparedness that we have been doing, over all these decades. So we have much better codes now. We have much better, ways to respond to disasters, and those have reduced deaths. But on the other hand, because they saved lives, of course, they did, increase the number of affected people. So we talk some of them, for example, on the injuries. So it's great that you don't have as many dead people following an earthquake, for example, but you've got also to be ready that those ones who didn't die, which is great, they actually are injured. So therefore, we need to look after them. And that's basically what you show there. And then here, as you can see, so here, how many people died, for example, 2012, 2.9 billion people were affected. And of course, the loss, we talk about 1.7 just within those 12 years. So it's not really a long period. Okay. So the answer to the question, why major hazards? Because they affect everything, absolutely everything. So they damage properties. They slow the development. Those SDGs that we were talking about just a little while ago, they will slow them. They will not let them kind of progress. And of course, they threaten our lives. And that's extremely, extremely important, because what's the point of us if we are not, kind of living comfortably, and we're not working and doing all this? We want to have cars, and we want to have beautiful houses. We want to live in a really, really comfortable life. But actually, when a disaster occurs, we find ourselves that actually going back to square one, where, we have to get just the basics. So I'm sure that, these pictures, as you can see, even though they come from different countries, so some from Japan, some from the US, some from Africa, some from the UK, some, from, different parts of the world, as you can see. But those, they describe exactly what disasters do to us, in general, us. Okay. If we be more specific here now, the disasters, they have the ability literally to wipe everything out. The picture that we can see here on the left is taken from a town in Japan. It's called Onagawa, and that's before the tsunami of 2011. The right picture is exactly the same town, but it is after tsunami. As you can see, absolutely everything is gone. So it says it all. Exactly what disasters can do to us, or what hazards can do to us. So obviously, this is what was happening on the ground. So in terms of politics, in terms of countries, etc., they got together, the United Nations again, and they came up. Okay, is that we need to come basically with some framework to reduce the impact of disasters, because we don't stop an earthquake from happening. We all know that, but we can mitigate the impact by preparing better, by learning how to do things in a better way. Okay, so as you can see, so these efforts started in 1989 almost, and they kept going. And the current one, we are in the Sendai Framework for Disaster Risk Reduction. Okay, and will keep going until 2030. So for us, from 2015 until 2030, there are, in roughly speaking, 7 targets, categorized under 4 priorities. The top priority we have is not but priority 1 is understanding the disaster risk. Understanding disaster risk is where seismologists can help us, for example, with really people fundamental, like Dr. Muhammad can help us to understand how those tectonic plates move, how the source itself of the hazard, how things work. So all those will help us understanding the disaster risk, but the disaster risk as well is much bigger than that as well. So the next priority is strengthening disaster risk governance. Now here we're talking about management. Okay, we're talking about here perhaps politics and policies. What we can do in order to make sure that that strengthening the disaster risk governance is to ensure that the impact is much lower than what we always have seen. Priority 3 is investing in disaster risk reduction, okay, or for resilience basically, and this means that we have to strengthen a lot of our infrastructure, of our communities, and of so many other things as well. That also is something that we'll be discussing in the next few slides, is basically how we can improve, or how we can do that. So that's one of the part of that investment that we're talking about. And the 4th priority is enhancing disaster preparedness for effective response and build back better. Many countries, when they get any disaster, when they build exactly the same way as they built it originally. And so it's very much kind of, you haven't really built anything properly. You just kind of repeated exactly the same error again. So here, this is another big issue that perhaps needs to be considered by many in many cases. What about the Arab region? The Arab region, and specifically Algeria, Tunisia, Morocco, Egypt, just name it, all those Arab countries basically. It's great to see that they are catching up actually now with disasters, because we always thought that area is safe, even though we had some experience, but we always thought, oh, it's safe. We don't have really a bigger problem. So now it's great to see that the Arab states basically understand that these natural hazards, or they can even be man-made as well. They are actually really a big threat, and therefore they need to be they need to work on them. And the last statement I like it very much, which I take from their output. It says paradigm shift from disaster risk management to a more comprehensive and risk resilient development practices. So we're talking about here moving from that disaster management to disaster mitigation or disaster risk reduction, because both of them are completely different. The disaster management to me is very much about kind of, you sit down, wait for it to happen, then okay, let's start managing it now. While the other one is you prepare for things and you start working in order to face them, to mitigate their impact. So it's completely two different. One's a proactive, the other one is one is a proactive, the other one is reactive. There you go. So, sorry, forgot something else here now. Corona. Perhaps the beauty of Corona is, even though it's really not a beautiful thing, obviously, because it did kill over 6.5 million people, and of course it did affect 625 million. However, the beauty of Corona is that basically it made us feel what a disaster could look like when you are forced to do something in order to respond to that. So that's perhaps the beauty of it. Any other thing is literally very, very ugly, to be honest with you, because it's not good thing. So in summary, so we need to expect higher infection rates, no matter what disaster it is. This happened in Haiti. This happened in, of course, Corona, as we know. So wherever you go, when we say disasters, straight away we talk about infections with it as well, because that's something that basically will come over time. We'll talk about as well more injury rates. Sorry, that's not injury, that's injury rates. So specifically here to talk about geophysical, like earthquakes. We can expect that those rates will be much higher. And then, of course, following that, there will be a lot of mental health issues. And there are so many other things as well. All of these, what they tell us, that there will be a higher demand for health service. And that the health service will suffer delays. It is as simple as that. So, the next question comes to us is, what do we need to do in order to ensure that our healthcare service is operational? And this is where things will start. And this is where the complexity will start. So let's look at the patient. Patient in general could be injury, could be patient, could be anything. What do we expect from that person? To go to the hospital, and then go to receive treatment. Now, there are two different routes. So they get treated, or they can be treated, and therefore they have to be admitted. So they can be treated, they get treated and they go home. So that's good. Or they can be treated, and therefore they have to look after them and then keep them in the hospital. In other words, admit them to the hospital to be treated. Or if we cannot treat them in that particular hospital, then we have to transfer them to a different hospital, and therefore we start the loop again from the very beginning. If you look in the hospital, what we will find? We find that there are 5 key factors. Those factors, you cannot talk about a hospital without having them there. It's impossible, basically. So we have the building. The building could be a tent sometimes, but even though it's not really classified as a building, but it could be even a tent sometimes in some particular disasters. These can be tents, because they find equipment inside them. You find everything almost inside them. You have utilities, or lifelines, sometimes we refer to them. So power, power, water, gas, name it. All those, internet nowadays as well, because the vast majority of the systems now are connected to the network and to the internet. So therefore, internet is part of the lifelines now. Equipment, X-rays, one of them, for example, MRIs, perhaps. All those equipments. Without them, I don't think that the doctor will be able to actually diagnose what the problem is and treat the patients properly. Supplies. Supplies is perhaps everything else. Water to drink, for example, bottled water I'm talking about here specifically. PPE, personal protective equipments. Talk about medicine. We talk about so many other things there. So all those, they go inside those supplies. And then, of course, we shouldn't forget staff. Because I don't think that we can, if we have the most beautiful hospital, we'll find some cases later on, we'll talk about them, where you have a beautiful hospital, everything is operational, but you don't have staff. That's not a hospital. So these 5 key factors, or key elements that influence our hospital, are they the only ones? Probably say yes, but actually they're not really, because how they work with each other, how they interconnect with each other that's when that dilemma will start. So, for example, we find that the building equipment, they are connected to each other. So, in many cases, the building itself could have created a problem to the equipment, or the equipment created a problem to the building. That's one element, for example. So there's that interconnectivity there between both of them. Sometimes that can get even bigger than that because you have the lifelines, the utilities, the building, and the equipment. All of them are connected with each other, and they can create for you. One of them creates a problem, all the others will not work automatically because of a problem or not. We will see some cases later on. Okay. Staffing. Perhaps you'll notice that I will spend a bit of time on staffing because staffing is one of the really, really extremely complicated factors. They seem to be very, very simple, but they are not. Okay, because staffing, they come with their professional and their personal circumstances, and we'll talk about them in more details. The other thing as well that we added here to this is the suppliers. So let's say, for example, your hospital has got electric power, but then that electric power is supplied by a supplier. So if the supplier themselves depend on other things and they couldn't supply you with electricity, what are you going to do? So the functionality of your hospital depends on suppliers as well. Okay. So as you can see now, it started getting really, really complicated. It's not really that easy. Okay. Even though this is really a simplified model, and then we will see toward the end of the presentation that actually how big it could be, and that's not the biggest, but it could be as big as that. It could be much, much bigger than that as well. Okay, and the last one is perhaps the roads, which unfortunately I haven't added it here. The roads are extremely, extremely important as well. Okay, because without roads you cannot go to the hospital. It's as simple as that. Without roads you cannot expect your suppliers to bring you the PPEs and to bring you all what you need. Without roads, your staff cannot access. So they are extremely, extremely important. I don't know exactly why I did, so I do apologize for that. Oh, there we go. That's accessibility, because that's accessibility. That's the one that affects everything. Okay, so that is our network, and that's basically kind of closed all that loop there. Okay, now let's look at these almost one by one. Not all of them, but just we'll pick up kind of just a few of them and talk about them. Building integrity. Building integrity from what you can see here. So these are pictures that came. Some of them from Japan. The one from Algeria, it's 2003. Apologize, that's not 2011, 2003. And that particular hospital is called the Thnia Hospital. It is in Boumerdès. And that's, as you can see, that's the emergency department, basically. That building is extremely, extremely old. It's 1800. It was built in the 1800s. Now, the problem of the buildings, as you can see, so they are different. So in Turkey, for example, the three bottom ones are hospitals in Turkey, in Van city, which is very much on the east. It is on the east of Turkey. So as you can see, there are different problems that structures suffer. Okay, so it depends on what kind of earthquake we're getting in, but it also depends on the quality of the building, the age, etc. As we can see. This was a study that was done a few years ago. I'm talking about the table here specifically, where we compared the performance basically of buildings worldwide, of hospitals here. And we find that the hospitals, they are extremely complicated. I'm talking about the building again and the structure, because they don't just depend on the country, but they depend on the country, depend individually, they are different. So you can find two hospitals, two beside each other. One is functioning 100%. The other one is not functioning at all. It's completely demolished, for example, for earthquakes. The reason why, because different material, different designers, different construction. There are so many factors that contributed to that. The other pictures that you can see there on top, that's a recent research that we conducted in Japan, and where we can see two different hospitals. So that's H112 and the other one is H137. As you can see, the H112 had plenty of issues, while the H137 didn't have any problem. It just worked perfectly. I'm talking about here from building point of view, of course. So as you can see, and these two hospitals, they are close to each other, by the way. Okay, so this confirms what we have just there, because there are so many factors. So there's a design, as we said, so there's the design of the building itself, there is the construction of the building, there are so many different phases, and you don't know when the problem will infiltrate, and therefore that's where we get what we get. We get a big diversity in the performance. So this is the study that we conducted recently in Japan. And as you can see, the buildings, they get aged, and as they get aged, as their integrity starts reducing. But as you can see, we're talking about hospitals that can reach 100 years old, a building, and they're still operating. Some of them, of course, they can perhaps fail from day one, as you can see there, but others, can go with you up to 100 years old or so. Or at least here in this case study, that's what we found. We found, that some of the buildings are approximately 100 years old, 92 years old or so, as you can see there. But also we learned that as much as the hospital building is closer to the seismic intensity or the high seismic intensity, as much as it tends to kind of get affected. So the issue we have here is that basically we need to identify the fault lines. That's one. We need to understand our soil. We need to understand all that the ground issues, and kind of not predict, but somehow if we kind of predict, where the intensity is going to be, and then when we develop, our drawings, etc., to build in a particular, choose a building we're going to build, we build it in the least risk area rather than kind of the high area. This is also the same thing as well. So we've got here the PGA, which is the peak ground acceleration, and of course we have the faults themselves as well. So of course, as you get away from the fault, as you have much higher tendency for your building to be operating, which is perfectly normal. So if an earthquake takes place in a place, for example, let's say 200 kilometers, yes, you might feel it, but actually, it most probably will not do anything to you because it's very, very far from it. And then, of course, same thing as the acceleration increases. Then, of course, as the building is subject to much stronger shaking, and therefore it will there's high risk that actually it will be damaged. Now, the strength for this one actually is that we found is that Japan, because they changed their regulation in 1981. By doing that, they saved approximately 10% of risk or of damage to their hospitals. That's what the study concluded, and that shows you that basically the importance of having really, really strong code for building and for disasters. So, talking about again the building integrity, and as you can see, this is a hospital in Van City. And it was literally, when we were there, it was literally 3 months old, and that's exactly because we went there just a few days after the earthquake in 2011. So as you can see, it is literally a 5-star hotel. So absolutely no damage to it whatsoever, and it was inaugurated those 3 months or so by the president. So this hospital actually, believe it or not, didn't work during the earthquake. Why? Because the staff refused to work inside it. They were working fine, but then they decided, actually, no, I'm not going to enter this building. And they worked in those tents, that you can see there at the bottom of the slide, those tents at -5 degrees Celsius. So staff were not happy to work inside a 5-star hotel. So we don't know what the problem is. Most probably it is because they've seen damage around them everywhere, and therefore they got scared. So they didn't want to work inside the hospital. They didn't trust it. And that is one, perhaps, of the big issues of staffing. Okay, let's move to the lifeline systems. Just put the building on the side for the moment. Let's try to discover these ones. The equation that you've seen there is extracted from a number of factors, which are shown there in the table there. So we've got electricity, we've got telecommunication, we've got gas, water, and all other systems as well. And what we learned is that basically electricity, water, and other lifelines, without them, your hospital most probably is not going to function as it should be. And that equation there is the one basically that can tell us, whether the hospital is subject to, will function or will not function. The Y is basically the one that will tell us that that probability, will give us that probability. Okay. The problem, as we were saying earlier on, so it could be an internal problem, as you can see in the picture there in 2004. That's an earthquake. That was an earthquake that's inside the building, hospital building. They were trying to repair some leaks, some water leaks to the pipelines. But also it could be outside, and the outside, that's one of the substations in the UK, and that's in 2007, where it was almost submerged. So if you talk about that, there is a huge proportion of of England would not have electricity if that substation was submerged. So there are some issues here, as we can see as well, with the lifeline systems. Okay, now talking about that interconnectivity, these pictures were taken just a few weeks ago in Taiwan, and what you can see there is basically this is a system that is used for dialysis. And the problem they have here is very much is this little cylinder here, because the cylinders are standing up obviously on or are attached to the ground, but this one were not really attached properly, so therefore they moved. And when they moved, it's basically kind of a pipe that is connecting all the cylinders together. And that, of course, means that the system will not work. So they had to find out how to do that, and they added those plastic pipes in order to connect the cylinders again, in order to ensure that the water is suitable for those really vulnerable patients. Because dialysis, it's the water has to be absolutely 100% clean. Otherwise, you could basically insert problems, in the patient's body, and cause them more deterioration. So this is, as you can see, so here we're talking about issue of equipment leading to an issue of lifelines, and then of course affecting the hospital functionality, and in other words affecting the patient's care. And that's really the key problem we've got here. Looking again also at the lifeline systems, what we learned is that the lifeline systems as well, they get older. Okay, as they get older, their performance reduces a lot as well. So, for example, the picture here on the left shows us that they could lose after about 40 years or so, 45 years, they could lose easily 35% of their capability. Okay. However, believe it or not, both pictures, they are exactly the same picture. Okay. The picture on the right, the difference is those are averages. The one on the right is individual hospitals. As you can see, the tendency there is very much constant, which means what? Which means that your system, your critical lifeline system, could operate with you for 80 or 90 years old with no problems if it is well maintained. That's the condition. So if you've got a system, you must maintain it as the manufacturer says. So if it is once a year or once in 5 years or whatever, you maintain it. It should be working absolutely fine with absolutely no problem, for a very, very, very long time. Okay, but if it is poorly maintained, it has issues, anything, then of course it could create those kind of problems to you. Okay. Now, we look at these lifeline systems as well, how they affect the patient's care. And what we found, here what you can see here on the left, so those are the hospitals, but then these are the emergency rating of the hospital. This is the case of the sample that we had from Japan, by the way, is from Kumamoto City, or not Kumamoto City, Kumamoto region, and it was following the 2016 Kumamoto earthquake. I can see that I'm really late, so I need to go faster.
No problem, Doctor. Take your time.
you.
You're enjoying the presentation so far. Yeah, please.
Thank you. So what we found here, we found that actually that basically tertiary hospitals are the ones that get affected the most. And what we mean by tertiary hospitals are those hospitals that are specific for a particular type of kind of really those critical elements. Let's say, for example, cardiology, or we talk about, burns, or talk about a particular, absolutely particular type of patients. So you find an entire hospital, or for example, cancers or things like that, you find them working for a particular type of illness. So those are the ones will suffer the most. Why? Because those everything they have there has got a clear purpose and is working 24 hours non-stop. So any small here or there straight away, that will affect the patients, and that's why they rated themselves really high there. They can be affected. I mean, that's very very much basically by any damage to these systems. So I'll go a little bit faster now. Okay, now here this is a bit of complexity as well with the equipment. So we took these very simple nurse saver, as you can see there on top, and all we did is just we locked or unlocked the wheels. That's all we did, and we found that it behaves completely differently. So if we lock the wheels, then it becomes kind of a rocking box. Okay, it starts kind of rocking, and then it falls at some stage, as we can see there in the figure. The last figure. So at some stage they will fall, they will topple, and that's it, and then everything will get damaged, and they will create problems around them, and etc. But if you leave them on their wheels, most probably they will start kind of just kind of moving around and so. But even that is not good as well, because when they move like that, they can damage other things as well with them. So therefore, in both cases, we've got to be very careful with these equipment. Okay. The equipment performs as well. Now, talking about, if you talk about the bigger or larger equipment, so like, for example, MRI, CT, the blood test machines and all those, as you can see here. So many of these, in 2016 Kumamoto earthquake, as you can see, all these, they were affected because of direct damage to them. It could be water, as W there says, and then it could be E, which is electricity, or it could be both ED. Therefore, there was a problem with electricity, and there was damage to the equipment as well. So this is also another problem of interconnectivity and how those kind of influence the equipment. Staffing. This is it's another very interesting thing, and perhaps we talk so much now about staffing, and they're moving, and people are not staying in their countries and go elsewhere, they go do other things, etc. It's simply because staffing is a really complicated and complex problem. Already we know that there is a massive shortage of staffing. I'm talking about on a day-to-day basis, but that during disasters that gets even bigger. So roughly speaking, there is so many statistics here as we can see, and in different parts of the world. So there's in Japan, there's in the US, and there are so many other places, UK, etc. But the most important message we take from these is that basically there's approximately 50% of staff will be absent post disasters. Okay, for a reason or another, but that's what roughly speaking, as we said. So it could be 40, it could be 60, it could be 70, it could be 20, but on the average perhaps is around 50%. So imagine your demand is massive, is so high, but then on the other side, your resources are extremely low, and one of them is staffing. So that's which created so many other problems that comes after that. Okay, so it's very much, as you can see there, that's a picture basically that tells us all, which is the demand is massive, and no matter what you do in order to cope with that demand, because the door is small, the resources are small, you cannot cope with it, and therefore that's what causes the delays, and what causes so many other problems in mental health amongst staff as well. Or we talk so much about the post-traumatic stress disorder. And this is one of the big issues that many healthcare staff have, in many countries, specifically now. Perhaps if you have a look what's happening, you find that a lot of staff is suffering after the experience of COVID. Okay, so we did some research and we tried to understand. So we asked people basically, are you willing to attend your work even if you don't get paid for it, for those extra hours? What we found 43% of people haven't made their mind. Some have made their mind, said yes, no problem, I don't have any issue with that. Others said no way, I'm not going to expose myself to risk without getting paid. But the other ones, 43% said I'm not sure. So those ones could be moved this way or the other way, and therefore that's down to decision makers of the hospitals, obviously, to decide how to deal with their staffing. We did another recent research and where we looked at the capability of staff to attend their hospitals. And we looked at, if you remember the first diagram we talked about earlier on, talked about professional and personal circumstances. So in the personal circumstances, we looked at their dependencies. So that could be children, could be parents, could be partners, could be anyone. Okay, and then we looked at the travel, how they travel, how they go to their workplace. Okay, do they walk? Do they go by car? Do they walk? Do they go by bicycle? Whatever way, basically. And then we looked at the professional circumstances, and there specifically we looked at the training and we looked at their mental resilience. Okay, so concerning the personal, circumstances. Okay, what we found that those who live, within 5 kilometers, about 2 miles, roughly speaking, 2 to 3 miles. Okay. There is 79% of people, so which means that's really, really high chance for them to come. But then as that distance gets bigger, as actually their capability reduces, because they might not find how to get there if they are taking public transport. Roads could be damaged, could be overflowed. We don't know exactly what it could be. So therefore, they will not be able to attend their work. So we're talking about really, really high risks here. Okay, and then same thing with the dependency. So with the children, with parents, etc. Okay, as you can see from the bottom table there. Okay, from 63% with dependencies, and then we go to 73% without dependencies. So as you can see, there is about 10% difference here. Okay, and that of course will affect the overall circumstances, and therefore people will not be capable. We are not talking about the willingness, we're talking about the capability. There's a big difference between willingness and capability. Capability is that you might be willing to go and help, but you cannot because you've got someone at home and you must look after them. And sometimes there are some regulations that will force you to look after your child, for example. So you cannot do anything to them. So you've got to stay with them, for example. In different countries, obviously, I'm talking about here. Okay, so as you can see here, so we've got some issues, and the capability of staff is not or the personal circumstance of staff is not something small that we should neglect. Okay, so it's something that hospitals need to factor that in as well. And then we looked at the professional circumstances, and the professional circumstances, what we found that the mental health resilience is pretty low. Okay, we are talking about approximately 60%, 60 to 70% average here, which is very, very low. So that means that the person is already extremely tired. Okay, and therefore don't expect them, because disasters, what they do is they push you more. So therefore they need you to be really relaxed person, and they need you to be really, really kind of calm, a resilient person to cope with all that change. So if you are already working at extremely high level of stress, most probably you will not be able to cope. Okay, that's number one. Number two, we looked at the trainings, and as you can see in the table here, despite the average experience that these people had, all of them scored just 13%, which is extremely low. Okay, and no matter whether they are female or male, full-time, part-time, no matter what it is, they are all basically not getting any training about disasters, and therefore that's another shock that they will get during those disasters. And those are the issues that will cause them a lot of mental health later on, because they never expected that kind of stress and that kind of level, that kind of, sometimes the decision is really, really tough. just to give you a small example, imagine a nurse or a doctor or anyone. I've got two patients there, and they've got only one ventilator, for example. One is, let's say, 90 years old, okay, the other one is 40 years old, and they cannot, they have only one machine. Which one do we give it to? So they decide at some stage, they say, okay, we'll give it to this one, but then after that, that corona and everything just comes down, things come down, those images will come back to him or her, and they will make them feel that as they killed people, and that becomes another stress. So it is not really as easy as it might seem. It's really, really tough decision sometimes, and it's a lot of things that staffing need to be aware of. Okay. Just to go quickly as well through this is basically the impact of service. Those who have really high experience, like for example 30 and 35 years of experience, those are the ones who actually, their absence make a lot of difference within the healthcare. Okay, and the reason is simply because they know the detail of the work, the organization, how things work, etc. So they are literally encyclopedias moving there around you. So if you ask them for anything, they know how to resolve it. Okay, for the young ones, they have less impact. However, this does not mean that we should exclude them from the disaster response, because those are that new experience, that really kind of mature experience of the future. So therefore, they have to be involved in those kind of work and that kind of cycle. They keep going. The right picture now shows that technicians, okay, are the ones, okay, who can have highest impact on the service. Now, who are these technicians? So technicians are those who are working, for example, sterilization, laboratory, technicians, staff, etc. People, perhaps you and I will never look at them, will never see them. Why? Because they're always hidden somewhere inside. So those are the ones, when they get absent, the doctor will get stuck. Oh, what to do now? I don't know what this patient has, and I need that person to help me with this machine, because I don't know how it works. So we found ourselves in that kind of problem. So this is another issue of staffing. Okay, perhaps this is, I think this is the last one about staffing, if I remember well. Radiology and acute care are the most vulnerable services for this particular case study that we are presenting here, and this case study is part of the UK. Okay, and it's as you can see, so there are so many professions there, or so many services there, but acute care again and radiology, those are the most vulnerable services, and the reason is simply because there isn't enough staffing inside them, or the staffing that they have is perhaps, again, it counts perhaps it's not sufficient, so it's very low number. But that's, of course, the low number does not mean that's 1 or 2 people. It could be 10 people, but then the demand is very, very high. So as you can see, so it's not really, it's very much kind of ratio rather than anything else. Okay, so the impact of on healthcare. Now, let's try to summarize this. In terms of evacuation and transfers, this is again going back to that Kumamoto case study. What we find that water, gas, electricity, all those, they can cause you to transfer your patients to different hospitals, and therefore create some chaos around the healthcare system and the way how it works. Okay, as you can see, the type of patients that we have there on the right side and the numbers, etc. So there are many people, they are inpatients, and many of them are dialysis patients as well. So those had to be evacuated or had to be transferred to different hospitals, and that's, if you remember the diagram and that complexity around it. So it's not really, it sounds very easy, but it's not. It's really, really complicated, the process that they have to go through, and unfortunately some of them die on the way, by the way. It happened in a few cases. And the other problem we've got here is that, again, that hospital functionality, as much as it gets lower, as much as the risk of evacuation transfers gets higher. So that's why your hospital needs to be working 100% if it's possible. We understand that's perhaps not really achievable post disasters, but if you get to the 95 or 99, that means that you can manage the situation. But if you get to 70 or 60 or 40, most probably you will not be able to manage the situation at all. And that becomes really, really much bigger than your capability. Just a few more slides here, just to explain a few more things. Specifically, perhaps if you look in the literature, we'll talk so much now about the net zero. The net zero is basically about reducing to climate change. It's about reducing carbon emission. Hospitals, because of their nature, because of the way how they work, they emit absolutely huge amount of CO2 in the air. So therefore, what they are doing is that they are kind of fueling climate change, but at the same time, they are asked to look after the consequences of it. So just to find themselves kind of working in really, really difficult, complex cycle there, and that's basically why there is this net zero. And this paper is pretty old, obviously, but it's basically still really, really valid, because the net zero, for example, by 2045 or 2040, the NHS, which is the National Health Service in the UK, are expected to become zero emission. It's very, very ambitious and very, very tough target, but it's everyone now is trying to achieve that. But doing that means that we will be able to at least freeze the climate change to some extent. We're not going to stop it because that's a cycle started, but at least we'll kind of reduce it and mitigate it. Another problem here, but this is perhaps more pre-hospital, which I will perhaps jump over just for the sake of time. Also, this is how things work pre-hospitals and then inside the hospitals and then post-hospitals. So those are three, basically, when you're responding to mass casualty events. That could be explosions, it could be earthquakes, could be so many other things. Okay. And now this is perhaps the complexity that I was talking about earlier on. So earlier on, we looked just inside the hospital. But here, as you can see, each box of those is actually a different organization. And your main organization is that healthcare provider. So you've got the patients coming in, the patients coming out, okay? But then in between, you've got a large number of controllers that are on top. And those are, for example, the regulations, those are the funding bodies and all those, the government, etc. But then at the bottom, you've got another massive number of resources, people who are providing with support. So if I give just one example here, and then we go to the next one. So this was developed 2015, so it's very, very old by now in the UK, obviously. For example, your waste, the waste of your hospital, how are you going to throw it? You don't just go outside and just throw it and that's it. No, there is a regulation. Okay, there is a regulating body that you must follow, and here it is the Environment Agency. So the Environment Agency is the one who will provide you with all guidance and all the resources, etc., in order to know how to get, because some of that waste is hazardous, and you don't want to create a problem to the environment or to people. So therefore, there must be some other support from other organizations. So as you can see, there is an ambulance, there is the highway agency, there is the army, the police, and all those are kind of there also working as well to help for the healthcare provision as well. This is Dr. Mohammed. Are you happy for me to show this, or?
Yes, please, Doctor. Please go ahead if you have some videos. Yeah, no problem.
Honestly, because I'm just aware of the time, I don't want to.
No problem. Yeah, please take your time. This is your lecture, and we're really passionate about what you are presenting. So it's too bad if we just leave you go without taking maximum information.
Thank you very much. So yes. This is just 5 minutes long video. And it is taken. It's in Japan, in Tsukuba specifically, and it's called the E-Defense, Earthquake Defense. It's the largest shaking table in the world. So what we can see in front of us here is a building that was made or that was built on top of the shaking table, and it looks like office, kitchens, so many other things. So as you can see, there are those small they look small, but those are actually big rooms there. Then we'll see them. So there are so many cameras inside this building. Okay, they're going to use Kobe earthquake wave. Okay, in order to shake this building. Structurally speaking, there will be absolutely no problem. As you can see, extremely strong building. But they are looking here what happens inside the building itself. So each each camera will be recording approximately 50 seconds. So we'll be repeating it, but then every time we'll see a different, different view, so a different camera basically. So I'm going to play it so that we all can see what's happening. So this is an office, and here there is no protection. So we'll see what happens here. So that's just the other angle of the same building, of the same office. This is an office as well, but this one has got some protection to it. So the damage, as you can see, will be reduced, but it will not stop. And that's why we call disaster mitigation, because you took some actions in order to reduce the impact, but you cannot stop it from happening. The protection in reality is slightly more complicated than that, but I think they did that intentionally for the experiment in order to show basically the difference between a bit of a protection and no protection of that sort, to show that kind of difference. This is a typical living room. I'm sure that Dr. Mohammed knows this very well. Typical Japanese living room. And here we can see basically what can happen. Here in post-earthquakes, usually there is a lot of what's so-called crush syndrome, and the crush syndrome tends to happen a lot because of these problems. This is also another typical bedroom, Japanese bedroom, where people sleep on the floor, and this most probably the person here will be dead. We'll see now. There's also another crush syndrome as well. So crush syndrome and head injuries and limb injuries and all those things is likely to happen because those things that they fall on top of people. I think I will stop it here because it's exactly the same thing. This is just a kitchen basically, but just for the sake of time, I will stop it here and go to the conclusions. And this is the last slide. So hospitals are certainly amongst the most critical service providers, okay, that are often affected by natural hazards. No matter what natural hazards we are talking about here, we're always talking about multiple hazards. Hospitals are extremely complicated systems, And they are of systems as well, so system of systems that need to be well understood, because without understanding them, most probably you will create, you think that you did something, but actually you haven't really addressed it. The complexity of healthcare service makes it very fragile, and perhaps digital technology might offer some help. This is something that we're still currently trying to research and trying to understand. Not just me, it's myself, and there are so many other people around the world who are doing this as well. And the last thing is that many countries, including Arab countries, need to work more to develop the resilience of their healthcare services and look after their hospitals. So that's my presentation, and I do apologize. It's 20 minutes later than I expected. So I'm happy to receive your questions, your comments. Please feel free.
Thank you very much, Dr. Nebil Achour, for a very insightful presentation. It is indeed a very important aspect that you are covering here. We've been inviting experts in this project. Actually, we've been inviting experts touching for the very engineering core of the discipline, but this is the first time we invite someone who's touching the soft aspect, I would say, or the social aspect. This is what I call social seismology. It's a part of social seismology because healthcare system is indeed a very important parameter. So we would like to remind you that, as Dr. Nebil mentioned earlier in his presentation, is we need to do some work before the earthquake, and this is what we are doing. Actually, hello, can you hear me? Here in this presentation, is we need to do some work before the earthquake, and this is what I think we have some connection problem. Just bear with me, please. So I think we lost Dr. Nebil from the webinar. Hello, can you hear us? Hello?
Yes, apologies. That was some technical difficulties that I had here.
No problem. Very glad that we have you back. So I think, so again, I would like to thank you very much for the presentation. I remind our audience that you can ask your questions and comments in the comment section, and Dr. Nebil Achour can answer some of them. I can see some question here, but before picking some questions, as I said, I would like to remind you that our initiative within us, this project aims to build scientific background or try to spread what is being done. So it is a part of social seismology, trying to raise awareness by these webinars. So let me pick some questions from the audience here. We have one question from Facebook. Thank you very much for your very interesting presentation. Medical infrastructure are indeed a major concern. How can we incorporate such disciplines at our universities in our region? We only study earthquake from an engineering point of view so far. Actually, this is what we were discussing before we start the call, I think. So maybe Dr. Nebil, please, some words about how can we help to enlarge our spec of disaster resiliency to the social aspect in our North African region and Arab region, probably.
I think it's a really interesting questions that Ahmed is asking here. It's what's the best way? The best way, I'm trying to find it myself, to be very honest with you. But I think having the beauty of things is perhaps is that what we can do is we can always build some case studies inside our teaching, for example, or inside our research. And I think that's perhaps something that kind of will trigger, questions, will actually bring people to start kind of questioning and answering and trying to kind of attract their attention. It's like, oh, okay, this is quite an interesting area I would like to start working on. Personally, I have, a master's in healthcare management that I'm leading. And we tried, our best now to include that. So we've been including it in the last few years. Kind of just every now and again, just to put small example, then ask students basically to look at those things. But this time now we have actually a module disaster resilience completely to look at that angle, and then of course will allow students to look at it from any angle they want, from engineering, from social science, from whatever. So it's just a way, basically, again, to attract, because we need a lot of people to work on this particular topic. It's extremely, extremely complicated, as you can see. So we need people to know as much as possible and to work on that.
Thank you very much for your response. We have another question from Ahmed as well. In Japan, the local community play a significant role on emergency response. How can we implement such culture in our countries?
They're asking to figure the question now.
Very specific, Ahmed. Yeah.
Look, I mean, it's absolutely yes. The Japanese, perhaps, they have already established their way of responding to disasters in general. But of course, that didn't come just easy as possible. If I be honest with you, if we take that and just implement it, it will not work. So what we need to do is we need a lot of initiatives and a lot of work with our communities in order to start helping them actually to appreciate and to understand and to believe that that's their way, in order to progress, in order to make yourself resilient. Don't wait for any other country, for any other people to come and help you. Yes, they will help you, but they will not help you as you would help yourself. So that is perhaps the key issue. So that it's really, really important for us to start actually kind of just raising awareness amongst our communities and telling them what needs to be done and work with them, because we always try to follow some hierarchy and try, okay, I'm the expert, I'm the one who understands everything, you just have to listen to me. No, that's the wrong style. The style is, come, let's work together, let's try to find a solution together, and then based on your experience and based on your expertise, etc., then you can start influencing this bit by bit by making them aware of those things, and then they will listen to you and they will do what needs to be done in the correct way.
Thank you very much, Doctor. Yes, all starting by awareness, and this is why I remind you that this is why we're trying to do these webinars, to try to initiate this kind of awareness. Thank you again. I would like to remind our audience that you can still ask your questions because I know there is some lag between the live and the questions. So you can ask your questions on the comment section. I myself have one question, or maybe more comment. I know that Dr. Nebil was a part of the Boumerdès 2003 earthquake experts who visited Algeria after the earthquakes, and you assessed, you saw with your own eyes the damages that we undertake during the 2003 Boumerdès earthquake. So, we are approaching the 20th anniversary of the Boumerdès earthquake, and we are trying to remind people. I know that all people who are born, who are 20 years age or less, they never really experienced the trauma that an earthquake can cause. So maybe if you can share with us some of your experience, your personal experience, just in a nutshell, about the Boumerdès earthquake, 2003.
It was basically, we went specifically, and we've seen so many things that we have seen. Some of them were bridges, some of them were hospitals, but we went specific to two hospitals, one inside Algiers, and the other one is in near the one that I just showed a little while ago. The infrastructure that we have in Algeria, and in the same thing is perhaps in Tunisia and in many other Arab countries, is pretty old infrastructure, and we haven't really spent much on the infrastructure there. And I think that's one of the key issues. Like, for example, when we ask, for example, one of the questions is, do you have an alternative server or alternative, for example, water source? They said, yes, we have. I was like, where is it? Oh, yeah, they just brought it now. They brought them a tank at that stage. So they said, oh, here we go. We have a tank of water now. I was like, well, that's not what we're talking about. We're talking about something that is permanently available on site. So I think we need to work a little bit more on those understandings and what's the requirement, for those disasters. And perhaps here, if I mention one of the tools that have been developed for this particular reason, which is basically raising the awareness and actually developing evidence for authorities, is the Hospital Safety Index by the WHO. It's a tool that's really comprehensive, and it's a tool that basically we have been implementing it, with WHO, etc. And we did it in so many countries, and it tend to really raise awareness and show that there is, where the weakness are of and the vulnerability are of our hospitals. So I think the best thing to say, there is a lot of strength in Algeria, absolutely massive strength, but also there are weaknesses as well, and that is perfectly normal to find, because it's impossible to find a country that is completely strong. It's impossible.
Thank you very much for your comment, Dr. Nebil. We have one comment in the comment from Dr. Rafiq Talib, we had the honor to have him as a keynote speaker 2 months ago. He is asking,
Good.
for developing countries working toward a better resilience of healthcare infrastructure in case of a disaster would be considered too expensive to deal with. Any comments? Thanks.
Okay, yes, they are expensive. Well, they're not that expensive. They are expensive. I mean, hospitals are expensive. Hospitals, they cause millions, perhaps billions. It depends what billions, perhaps it's a bit too much, but perhaps millions of dollars, to build them, etc. So if you don't look after them, of course you will lose them. Now, what United Nations says, for every dollar you spend on preparedness, you save it $15 on response or on recovery. So I would spend perhaps 5% extra, 10% extra of the cost of the hospital on actually preparing and making sure that there is a lot of preparedness done there to protect that infrastructure, to protect the service, rather than find myself struggling. And perhaps Corona is one of the one of the best lessons. As you can see now, we are living in a really, really horrible and very tough climate, financial and not financial climate, and all that's because of Corona as well. I know that there are other reasons, but mostly it's the Corona that has affected, or has at least started that, and that is because of the lack of resilience that we have. So yes, we have to spend, yes, absolutely, but that spending is for our benefit, not for our loss.
Thank you very much for very wise words, Dr. Nebil. Very, very much for the comments. So with that said, we will not hold you longer. I would like to thank you very much again on behalf of INAS, on behalf of everyone for accepting our invitation and sharing your expertise with us. For our audience, we remind you that we are still holding monthly webinars up to the end of this year. Stay with us for the next month, inshallah. So next month, we will have another keynote speaker. It will be Dr. Jilali Ben Nouar, who's going to discuss natural hazard governance in Algeria. So it's also touching a little bit more politic than structural engineering or geologists. So again, thank you very much for our attendance, and thank you very much, Dr. Nebil, for your very insightful lecture.
Thank you all. Thank you. Thank you very much.
Thank you, and salam.